South Africa has made huge improvements in getting people to test for HIV in the recent years. Recently, the Treatment Action Campaign led more than 1,000 people across 3 district-level marches to demand that people living with HIV urgently get longer supplies of ARVs. Let's get more insights as I'm joined by Morongwa Ntini, who is the Research Monitoring and Evaluation Learning Coordinator at the Treatment Action Campaign. Morongwa, a pleasure to have you on the program this evening. Last week, the TAC led marches in 3 districts to demand the longer supply of ARVs for people living with HIV. Can you share more about the motivation, but also the objectives behind these marches?
Good evening to Nhlanhla and the viewers at home, and thanks for having me. So we need to start here. Well, in South Africa, we have more than 2 million people living with HIV that are still not on the life-saving HIV treatment, right? And some of those do not know their HIV status. And most worrying is that we have hundreds or thousands of those that are out of treatment, right? So this is alarming that the Treatment Action Campaign took it to the streets within the 3 districts to demand for a very simple thing, which is the longer supply of ARVs. So the message that we're pushing is that we want our people living with HIV to get longer supplies of medicines.
So what challenges do people living with HIV face when they do not receive longer supplies of ARVs?
Of course, well, our clinics are in crisis, right? We live, okay, some of our patients is that they leave home very early in the morning, only to be seen in the afternoon, right? You can imagine how that is costly to the people living with HIV. I mean, you leave home early hours in the morning from like 6 a.m., not even 4 a.m., well, 6 a.m. until to only be seen around 2 p.m. That is very alarming. I mean, the filing system in South Africa, it's really a problem.
Yeah.
So files go missing altogether. You cannot find them at some point, right? And also we have issues of privacy within the facilities. Patients get no privacy within facilities. Well, they explain that you would be in the helping room, and then you get someone who gets to hear your consultants. So these are some of the issues that we face on the grounds, right? And most of all, medication stockouts, which is really a problem in South Africa. People get to face medication stockouts and shortages, and that's why we took it to the streets in Tanzania.
Morongwa, can you provide more details on the impact of these poor conditions that you speak of, and also this unwelcoming environment in clinics on HIV treatment adherence? Does it have an impact, really?
Of course it does. I mean, 3 months multi-month dispensing. What does it mean? It's simply that it simply means that patients don't have to frequent the facility, right? Yeah. Patients get to go within the facility about four times a year, right? So we solve problems that we face on the ground, like you don't frequent the facilities, you don't get to flood the facilities, right? So we believe as TSC that people living with HIV are entitled to get 3 months supply of medication, so that we solve issues of your staff attitude and your longer waiting times. So we believe that this is a solution.
Right. So I want to take a report from Richidze. It says there is a significant disparity in the percentage of people receiving the 3-month supply of ARVs across different districts. What do you think are the main reasons for these discrepancies that we are seeing here?
Well, I think our district Department of Health are not, within the 3 districts, are not taking us serious. I mean, the 3 MMD is within the policy, right? People living with HIV are entitled to get 3 months supply of medication, right? So if government is not taking us serious, it's worrying, it's alarming, because this is established. I mean, like, people are entitled to get 3 months medication refills. So it's puzzling us, and it's worrying us that people living with HIV are still ignored, and that the health system within South Africa is not taken seriously.
So also interesting is that Bojanala district reported a high percentage, about 97% of people receiving that 3-month supply of ARVs. Are there any specific practices or policies in Bojanala that other districts could adopt to indeed improve their ARV supply system?
This is very simple, that the Lejoleputsa, Thabo Mofutsanyana, and Dr. Kenneth Kaunda district health district departments need to take us seriously, because if other departments are doing it, what's failing us, what's puzzling other districts to implement the same system that other districts are doing. I mean, if other districts are doing so well, why can other districts not do so well?
So TAC, as we know, does advocate for the National Department of Health to really revise guidelines to allow this 6-month supply of ARVs. What are the main benefits of extending the supply period to 6 months, Morongwa?
Oh, sorry, I did not hear that. Can you please repeat that again?
I'm saying, speak to us about the proposal that's being made by the TAC. You are advocating for the National Department of Health to revise these guidelines to allow a 6-month supply of ARVs. What are the main benefits, if you will, of extending the supply period?
This is very simple, Nhlanhla. Like I mentioned, issues that are people living with HIV or patients in general that they face every day, right? So patients arrive early within the facilities, right? And they only get treated after the longest time, right? So that is the most alarming problem, right? And we want to solve such issues. And we say to the District Department of Health within the 3 facilities that, okay, let's now revise how we do our things all together. We'll have less waiting times within the facilities. We'll have lesser staff attitude, for instance, right? And would have, like, it would be a smooth operation within the health facilities as the NHI has been established. I mean, these are one of the things that we really need to put out there on the ground, that we need to start implementing what's entitled to people living with HIV. And of course, lives matters. We really need to put people's life first.
So you call it, or you desire a smooth operation, but what obstacles or resistance do you foresee in really implementing a policy change and extending the ARV supply period? And how can these be overcome?
Okay, I mean, it would be very disturbing for the district departments of health not to care about their patients or the people living with HIV, right? So we would hope and we pray, if that counts, that we get to be heard, right? I mean, people living lives, like I mentioned earlier before, that lives do matter. So people living with HIV need to be taken seriously, and patients to be taken on a serious account. So we really pray that we get to see like change, and we really see improvements within the facilities. As the second 95, as a country, South Africa currently is battling with the second 95. And if we put such practices on place, it means that we have such practices on place.
Right, right. So, Morongwa, from your perspective as a researcher and coordinator, what would you say are some of the most significant achievements that the TAC has made in really improving HIV treatment and care in South Africa?
And that TAC is a very positive social movement, right? So what does that mean? Currently in South Africa, we have the highest HIV rollout in South Africa, right? In the world. So people living with HIV, we have the highest rollout in South Africa, and that's one of the goals. I mean, we have about 6 million people in South Africa that are on ARVs, right? It's one of the biggest achievements that we've had, and we hope and we keep making sure that we see the biggest change, and we make sure that people living with HIV and every public healthcare user is given a priority within the facilities.
Morongwa, thank you so much for your time. That's Morongwa Ntini joining us today and providing valuable insights into the critical work that's being done